Good evening, everyone. Welcome to tonight's live stream event. Sorry, I think we're getting started just maybe a minute or two late. There's always a challenge with these live broadcasts here and last-minute efforts to get everything going. So welcome, and thank you very much for taking some time out of your evening tonight to join me. This night's presentation is Understanding and Funding Your Retirement Health Care. I think it's going to probably go about an hour or so. Lots of really valuable information, I think. For those of you that may not know me, I should have introduced myself. My name is Bill Letheman, and I am the founder of Letheman Financial. I'm also the creator of the Money Evolution blog. Money Evolution is something I created just about a year ago now as the educational piece of our business to try to get more educational content regarding financial planning, retirement planning, cash flow management, get that all out to all of you. So if you haven't been to our blog, most of you probably have, but that's located at moneyevolution.com. Check that out. There's probably upwards of maybe 100 different articles and videos up on the blog. We also have our YouTube channel, which also has our entire video library there. And you can also follow us on Facebook as well, under the Money Evolution Facebook page. So let's get into the presentation here tonight. So, why are we talking about healthcare? Well, healthcare really kind of fits into something that we recently came up with as a concept, and that's what I call the 7 core elements of retirement planning. In fact, we're going to be coming out with a whole bunch of new material that's going to be talking about this. And as most of you probably know, there's a lot of aspects that go into your retirement. And I actually came up with 7 of these things specifically. Number one element is to understand how much your retirement is going to cost and try to identify if there's any retirement gaps, if you're not quite where you want to be. You also need to look at where to save money. Lots of options: IRAs, Roth IRAs, traditional accounts. Deciding when to collect Social Security is another one of those. And then tonight's broadcast is actually going to cover healthcare, which is, I think, maybe one of the most overlooked or possibly underestimated of all of the retirement expenses. 401k is another one of our 7 core elements. Planning for retirement income. How do you transition from a portfolio that was meant for accumulation, and how do you start taking withdrawals from that portfolio? And then the last of the 7 core elements is investing. And a lot of times I know that's what gets the press, that's what gets all the excitement going, is what stocks or funds or investments to buy. But really, we want to look at investments only after we've properly addressed each of the other 7 core elements. And then we can choose investments. And that's really kind of easy because we just got to find investments that are going to fit in within that financial plan here. So we designed this presentation here tonight for those of you that may be thinking about retiring soon. You want to know or better plan for some of your healthcare expenses. So we're going to be talking about people that may be retiring prior to age 65. That's when most of you will be eligible for your Medicare benefits. We're going to talk about Medicare itself. That's going to be a big portion of the presentation tonight, in understanding Medicare a little bit better. And we're also going to be looking at ways that you can potentially reduce some of your cost as well, and understanding those costs a little bit better. So healthcare expenses, like I said, may be one of the most underestimated of all of the retirement expenses. If you think about some of your other big expenditures, like your house as an example, many of you hopefully will have your house paid off or pretty close to being paid off by the time you retire, so your house expenses may not be quite as significant. You've got food, utilities, basic expenses, lifestyle expenses like travel, golf, hobbies, whatever you like to do there, and then transportation, your cars. And healthcare is going to be one of those key aspects, especially as we get older and we have a higher demand for these healthcare services, and it becomes a bigger part of our budget here. So healthcare, we've got a lot of exciting things going on in the healthcare community, as I think many of you probably know or realize. They are actually 3D printing body parts now, and I think that's something that's going to become even more common. We're actually able to replace pieces of us, literally. The Human Genome Project, they finished that up a few years ago, much earlier than they anticipated, and there's actually some scientists now in Britain that are actually saying that chemotherapy could become completely obsolete in the next 20 years or so, because now that they have these genomes mapped out, they can specifically create medications and target the specific cells that they need to attack and basically ignore everything else. So really exciting things. But of course, this comes at a significant cost. And I think most of us realize that even though we are advancing medically speaking, the cost of these things are going to get more and more profound, basically. And here's an example here where they're talking about cholesterol medications. They've just developed some new medications. I don't totally understand all this, but they're called PCSK9 inhibitors to help people lower their cholesterol levels. They say that they can lower your cholesterol by up to 60%. But these new drugs actually cost about $14,000 a year per person. And if every person that is taking one of these cholesterol medications right now switched over to this new one, it would add $120 billion per year onto the health system, basically. And so when you think about that, and there's lots of debate going on right now, especially in Washington, of what they're going to do with Medicare, and are they going to expand it? One of the things that they were talking about is maybe they were going to lower the age of Medicare from 65 to 60, or I've heard even as low as age 55. There's a lot of debate about the Affordable Care Act, which is also called Obamacare. What are they going to do with that? Are they going to try to replace or repeal that? So there's lots of things out there, but if our healthcare costs continue to go up the way they are, it almost doesn't even matter who's paying for it, whether it's us as individuals or the government. Nobody would be able to afford healthcare, or hardly anybody would be able to afford it. So I think, to me, that's the more basic underlying problem that we have, is the rising healthcare costs. So when we look at this over the last several decades or so, back in 1960, healthcare accounted for about 5.2% of our GDP, our gross domestic product. And then in 2000, that had over doubled to 13%. And then this is from a JP Morgan healthcare study here that has some really great information. So the most recent data we have there is from 2011, and that jumped up from 13.8% up to 17.2%. So we're now talking about, almost a fifth of the entire U.S. economy is being spent on healthcare costs. So that's a big deal. Fidelity also does a pretty nice study pretty much every year here. And by the way, you can look these up online if you just type either of those into a search engine, the JP Morgan Health Study. That's actually called JP Morgan Healthcare Costs and Retirement. That was from April 2016. And then Fidelity, this is their 2015 healthcare study. And what they said is that an average couple retiring at 65 years old today could expect to spend about $245,000 on healthcare costs over their lifetime. So $250,000 just on healthcare costs. And I think that runs out to somebody that lives to be age 85 for a male and 87 for a female. So if you live beyond that, they say those costs could even go up exponentially even higher. So that's something we all need to take into consideration here. And then they also talk a little bit about healthcare costs being some of the fastest rising costs out there too. And I think as all of you do retirement plans, or as we do retirement planning, we need to properly estimate that. In fact, when we look at this historically, we should look at healthcare costs going up by about 5% a year. And then as you get older, you might even want to increase that from 5% a year on the inflation factor up to 7% a year in retirement. So again, these are running at 2 times or more the average rate of inflation when we look at the cost of those things. So of course, there's 3 areas that we can see costs. Of course, we've just talked about it, the actual cost of the healthcare itself and how that's increasing, the underlying medical care, whether that's your doctors or the prescriptions that you're paying or the tests that are being run. But we pay those through higher premiums. So most of us have probably noticed our premiums getting a little bit more expensive every year. Not only that, but they're also making us pay more. So we're paying higher premiums to the insurance company, but we're also being responsible for more of that out of our own pocket. And that's through higher deductibles and co-pays. And then they're also extending as well the maximum out of pocket. And we're going to talk about this, I think, on the next slide here and tell you what some of these terms and definitions mean here. So this is referred to as cost sharing. So when we talk about a copay, we're talking about that as maybe a flat fee, like for a doctor's visit. You might pay a copay of $20 or $25 every time you go see a doctor. Maybe it's $50 or whatever. You might pay $5 or $10 for a prescription, regardless of how much that prescription actually costs. That's considered a copay. Co-insurance is where the insurance company pays a percentage and you pay the other percentage. So maybe the insurance company will pay 75% and you'll pay 25%. So that's considered co-insurance. Your premium, that's what we just talked about, that's your monthly amount just to have the insurance that you're going to pay. And then the other one that's important to look at is your max out-of-pocket. So for example, you might be paying 25% as a co-insurance on all of your medical treatment, but they're going to also limit your maximum out-of-pocket. Sometimes they do that by the individual, and they also do it by the household. So that's important to note as well, especially for families. So I may have a maximum out-of-pocket for myself of $5,000, but maybe because there's 4 of us in my household, maybe the max out-of-pocket for the family is actually $20,000. So that's something to keep in mind there, and understanding, where all those different costs are, especially as you start looking at some of your own insurance and deciding which plan to choose for yourself and for your family. So again, what we're going to talk about here tonight are what I call 3 phases of healthcare. We're going to talk about the healthcare for people that retire prior to Medicare, before age 65. We're going to talk about Medicare. That's going to actually probably be the bulk of the presentation here tonight. But I'm also going to talk about long-term care. Hopefully, most of us aren't going to need that, but we do need to plan for it and consider that. That's nursing home care that may not be covered by some of these other areas here. All right, so let's talk about your Medicare, healthcare before age 65. So this is again from that Fidelity study here from last year. And what they say is that if you need healthcare insurance on your own and you're responsible for it, an average couple retiring at age 62 could expect to spend about $17,000 a year on out-of-pocket healthcare costs every year until they hit Medicare. So as you start to think about your retirement and start putting together some of these plans, that's a very important factor, because I know many of you out there may have benefits that you might get through work, early buyout packages, maybe even have spent about $17,000 a year at age 50 on out-of-pocket healthcare costs. You also need to really keep in mind on how these healthcare costs are going to become a factor, and especially if your employer is not going to give you any kind of help on that. This is going to be a big deal to have to pay $17,000 a year for medical costs. I mean, that's almost like a house payment for many people. So what are your options if you do retire? Well, one is definitely check with your current employer, especially if that employer is offering you current health insurance. Find out what they're going to provide for you in retirement, if they're going to provide anything, and what are those benefits. Sometimes it might be that, maybe they're subsidizing your plan currently, and maybe you're paying $300 a month for your plan, and maybe in retirement they'll still subsidize it, but maybe it's going to be $600 a month as an example. So you want to look that up on the HR website, or go visit HR, talk to some people, and find out what they're going to cover. And some employers offer maybe just a flat amount every year. Maybe they'll give you $3,000 every year, and you can spend that however you want towards health care. But find out what your employer offers. And also, too, especially if you're married, you want to find out what they're going to provide for your spouse as well. Are they going to give you any coverage for your spouse in retirement as well? COBRA, that's something you can keep your existing plan, and you pay the entire premium up front. So maybe, again, you were paying $300 a month for your health insurance, but maybe the true cost of that plan was $1,000 a month. Well, you can do COBRA, and you can pay whatever your employer was paying for up to 18 months after you leave, retire, separate service from a company. So that's something that you could do potentially to bridge you just until, let's say you retire at 63 and a half. You could do that for a year and a half until you hit Medicare at age 65. If you are married, you can look at what your spouse might offer. So maybe your spouse has their insurance and you have yours, and if you quit working or you retire because you're no longer going to be actively employed, find out if maybe your spouse, if they're going to still be working, if you could potentially go on your spouse's insurance coverage and find out what those costs are involved with that. And then the final one is that you could go into the health insurance marketplace, which is basically the Affordable Care Act or Obamacare. And we're going to talk about that here. So that is one option, and I think quite honestly that really opened insurance up for a lot of people that otherwise might have had some difficulty in a lot of cases getting insurance or maybe having it affordable. And I know there's definitely problems with it and it's not perfect, but the fact that you can get insurance, there's no pre-existing conditions that you have to worry about, there is some opportunity there for you to go into the marketplace here. So the marketplace could give you a little bit lower discounted share. And then one of the things that was built into the Affordable Care Act was that insurers can't charge you or charge anybody more than 3 times the amount they charge for younger individuals. So that is, again, something that for retirees, for older individuals, that's something that's keeping the cost down a little bit lower for them. Unfortunately, I think that might be raising the cost for some younger people, and that's part of the problem, but that's what it does for retirees, which I'm assuming most of you watching this are either thinking about retirement or in retirement already. So how do we estimate cost? There is a really fantastic calculator that I found. The Kaiser Family Foundation, who's done all kinds of research on healthcare, they actually put together a calculator here on their website. If you go to the Kaiser Family Foundation website, you should be able to find this. And by the way, I think everybody probably got an email from us about the event. If you want any information or have questions, you can feel free to send me an email. And if you want, for example, this link, if you can't find it on your own, just shoot me an email, say, hey, Bill, what's that link? And I'll shoot that off to you. But there it is right there if it's been on the screen long enough for everybody to see that there. But you can go into that, put your age, even put prescriptions, I think, in, if I remember correctly. $420 per year. So again, going back to what Fidelity said about healthcare costs for a couple before Medicare, if we just look at that, that's $17,000 right there just for the health insurance itself. That also is not necessarily a Cadillac plan where it's giving you all kinds of benefits. There still is potentially $6,600 of out-of-pocket costs that you could incur if you hit the upper maximum level on the insurance there. And it also may not totally include drug coverage. So that's a whole other deal that you might have to add some other plan for in addition to it. So again, retirement before Medicare, if you don't have anything through your employer, is very, very expensive. So a couple things to note here. Your rates are going to vary pretty significantly by zip code, depending on what state you live in and where you live. Those rates can be substantially different from one state to another. Again, you can't be charged more than 3 times the amount that a 21-year-old is charged. And again, tobacco use will cause your premium to go higher. I think I've mentioned on another slide here, but one thing I'll mention here as well. For some of you that may have 2 residences, I know we've got clients that live up here in Michigan, but they also have a second residence in Florida. If you could make another state potentially your primary residence, and you could check that out through that calculator, you could see if potentially that would give you a lower health insurance rate. But you also want to factor other things in there as well. The income taxes in that other state versus the income taxes in the state that you live in, and you want to make it legal and stuff, and you want to really be spending the time. You can't just make up addresses. But if you do have that option, you can definitely look at that as an opportunity to potentially lower some of those costs. All right, so now let's look at Medicare. And also, too, Matt, we have a chat window up for questions, I think, too, don't we? Or
yes, we do.
We do. Okay, I'm going to sneak over here, grab my water. I'm like a mystery person handing me a glass of water here. It's just a table. All right, so let's talk about Medicare. First of all, to become eligible for Medicare, I think most people know you have to be 65 years old or older to qualify for it. unless you qualify for a special circumstance, a disability, and you could get that earlier than age 65 in some cases. You have to be either a U.S. citizen or you have to be a legal resident that's lived in the United States for at least for at least 5 consecutive years. And your spouse's age doesn't count, okay? So this is very important as well. So if you're 63, but your spouse is 65 and getting Medicare, that doesn't mean you can get Medicare. That means your spouse can get Medicare. So it's based on every individual's name. And again, that's something that's going to go into the planning there as well. And even going back to what we talked about with employer plans, if your employer is the one that you're getting the health insurance through and you're older than your spouse and they're going to kick you off of the employer plan at 65 and your spouse is 2 years younger, you want to definitely find out how that works and if there is an option for your spouse to continue with that coverage or if you're going to have to do something different for them. So the initial Medicare enrollment is a 7-month window that starts 3 months before the month that you turn 65 and continues 3 months after the month that you turn 65. And you're going to enroll right through the Social Security website. And it's ssa.gov/Medicare is the site, but if you Google it, just make sure you're going to the .gov website. You should be able to find all of that information, or you could visit a Social Security office. I think most states probably have them. I know we've got tons of them everywhere around here in Michigan, or at least I see them all the time. There's a special enrollment period, so they do have an exception to signing up for Medicare at 65. All of you, if you're not working, you need to do this in that 7-month window. It's very, very important. If you miss it, there's going to be some pretty steep penalties for missing that. And we'll talk about that here in just a minute. So if you're still working and you're covered by a group plan at your employer, you can postpone enrolling in Medicare. So you can do that, and once you stop working or once that health insurance through your employer ends, you then have an 8-month window after that insurance ends for you to go in and enroll for Medicare. So there is that special enrollment period, and if you think that's something that you qualify for, you can look into that. COBRA and retiree health plans are not considered coverage. So if you retired from a company and they give you health insurance in retirement, and that does not qualify for this. It's only if you're still working. You still need to go in and get Medicare. Same thing if you're on COBRA because you retired, you still need to switch over to Medicare. And quite honestly, you probably are going to want to anyway. So there's also a general enrollment period. So if you, for some reason, didn't sign up for Medicare when you were supposed to, they open enrollment every year, January 1st through March 31st. The coverage begins on July 1st of that same year. But again, we talked about this a second ago, there is a very steep penalty for not enrolling for Medicare when you're supposed to. It's actually 10%, and you're going to have to pay that higher premium for the rest of your life. It will never go away. So actually it's 10% for every 12-month period that you didn't sign up. So you miss it by 1 year, it's a 10% penalty. You miss it by 2 years, it's a 20% penalty. So if I can stress anything, make sure you get enrolled in Medicare. And then they also have an open enrollment period for those of you that may be already on Medicare or once you're on Medicare. And every year from October 15th, so that's coming up here in just about a week or so through December 7th, if you want to make any changes to any of your Medicare plans, you can do it during that time. So that's another important date to keep in mind here. Okay. All right, so how do you get Medicare? Well, there's basically 2 main pathways that you can go down to getting your Medicare coverage. There's original Medicare, I call that kind of traditional Medicare, and then there's a Medicare Advantage plan. And so there's a lot of different parts here, and I think hopefully this is going to make a little bit of sense here. Okay, so original Medicare consists of a couple parts. Part A is your hospital insurance. I'm going to dive into all this here in a little bit more detail in a few slides. Part B is medical insurance. Then you have Part D, which is your prescription drug coverage. And then if you want, you can add a Medicare Medicare supplement policy called a Medigap policy, in which I think is usually a very good idea for most people to do. And all of that together is original Medicare. And then Medicare Advantage is the alternative. And think of that, it's kind of like an HMO or a PPO, and basically an insurance company is going to bundle all of that stuff in together. And we're going to talk about that in a little bit more detail. So basically with a Medicare Advantage plan, you're getting all of this just provided for you through the insurance company, and it might have some features that you like, and maybe there's some advantages or maybe there's some disadvantages with that, but we'll talk about that here in a second. Okay, so traditional Medicare versus the Medicare Advantage plan. Traditional Medicare, it is all the standard rates. So we're going to look at some tables on how much your Medicare is going to cost for Medicare Part B and Part D. And it also, very important to know, is that you can go to any doctor or hospital or caregiver that accepts Medicare. So especially for those of you that may like to travel, I like this option. I think I'm a much bigger fan of traditional Medicare than the Medicare Advantage plan, just because it's going to give you the most flexibility to go out and really seek that medical care that you want to get wherever you want to get it. Medicare Advantage may restrict you to a local regional area. So if you don't plan to travel much, you know you're going to be seeing all of your doctors in a Midwest area or in Michigan, then these Medicare Advantage plans might be able to offer you a network that could potentially keep some of those costs down a little bit. But again, keep in mind, if you travel outside of that network, you could have some fairly big cost involved with that. And then they have to include at least everything that traditional Medicare offers, so you're going to get all of that. But they also might offer some other benefits too that might be in addition to some of those things that aren't typically covered in traditional Medicare. So again, we're going to talk about these a little bit later. Okay, so traditional Medicare, again, it's composed of really 4 parts. Part A, the hospital insurance. Part B, your medical insurance. So that's doctor's visits and maybe specialists, things like that. And then Part D is your prescription drug coverage. And then the last one right here, they call this, I think, Part F, and that's your Medicare supplement policy if you choose to add that on. Okay, so some things that are not included with traditional Medicare: dental care. Most dental care, routine eye care, hearing tests, traveling outside the United States, your care is most likely not going to be covered. Custodial care, these are things that we'll talk about later, like nursing home care, bathing, dressing, eating. Long-term care is not covered. Cosmetic surgery and most chiropractic services are not in, and routine foot care are not included with traditional Medicare either. Okay, so Medicare Part A, the 2017 costs. So your premiums are free, technically. You've been paying into Medicare probably your whole working career, and as long as you have paid into Medicare for 40 quarters of working years, so about 10 years, then you will get Medicare Part A for free. Couple things to know here, and this is again your hospitalization. So every time you go into a hospital and have a stay, you're going to have a $1,316 deductible for each benefit period. And then the first 1 to 60 days, so you can be in a hospital, hopefully you don't ever have to deal with this, but if you're ever in a hospital for 60 days, you pay nothing other than that $1,316 deductible. From days 61 through 90, it's going to cost you $329 a day. And then beyond 90, you get 60 reserve days that you can use up over your lifetime. So let's say you're in hospital for 100 days, then you would have all of this. You'd have the first 60 days free. You'd pay $329 for 61 through 90, and then you'd pay a higher premium, $658 per day for those 10 additional days. If you ended up in a hospital at some other future date, you're going to go through the same thing. And again, if you're in a hospital more than 90 days, you're going to continue to eat up. You have 50 days left. You're going to continue to eat up that lifetime reserve potentially. So hopefully that makes sense. I know that's a lot going on there. Just try to stay out of the hospital. And I think it's important to know what those potential out-of-pocket costs are, because when we start talking about the Medigap policies, that's going to help to fill in some of those gaps in understanding what those things are. Even though it may be a remote possibility, hopefully, that you're in a hospital, again, this could still really add up for many of you. So what's covered in Part B? This is going to be your doctor's visits, ambulance services, outpatient medical, some preventative care like flu shots, pneumonia, labs, different tests, x-rays, CAT scans, EKGs, most of that's covered, diagnostic screenings for different types of cancer, and then some medical equipment like oxygen, wheelchairs, walkers, some of that's covered in emergency room services. That's all going to fall under Medicare Part B. And then I will talk about what you could possibly expect for your percentage of this, the co-insurance for Part B. We'll talk about that in a little bit. Okay, now let's get into what does Medicare Part B look like in terms of cost. Well, there is a schedule here. What I put up here is this is for I got both individual taxes and filing joint. So if you are single, filing a single tax return and your adjusted gross income is $85,000 a year or less, or if you're married, filing a joint tax return and your income is $170,000 a year or less, you're going to pay the minimum amount for Medicare Part B, which is $134 a month. And that's for you, and if you're married, then your spouse will pay $134 a month as well. And as your income goes up, we'll just stay in this joint tax return here, above $170,000 up to $214,000, that's going to take a pretty significant jump up to $187,000, and you can see down here for these upper income earners here that are above $428,000 a year, you're paying $428 a month in Medicare Part B premium. So for a couple in that tax bracket, you're looking at almost $1,000 a month for Medicare Part B. Okay, so many of you probably know, I think most of you, if you're on Medicare, you probably know Medicare Part B costs have been going up pretty significantly. So in 2015, just a couple of years ago, it was about $105 a month. The low level for a couple filing a joint tax return was $104, or a single tax return rather, at the low level, $104.90. The next year in 2016, so last year, that jumped up to $121.80 a month. And then this year for 2017, it jumped up again to $134 a month. So that represents a 16% increase from 2015 to 2016, and another 10% increase from 2016 to 2017. So again, we talked about medical costs rising, and again, one of those things is us as the consumers of that healthcare paying a bigger portion. Here's where we're seeing those premiums go up. Now, some of you may be noticing, well, hey, I haven't seen my premiums go up that much, or maybe at all, and over the last couple of years. And that may be true, and that has to do with a rule called the hold harmless rule. And what that basically says is that if you are having your Medicare Part B premiums deducted from your Social Security check, the increase in the Part B premium cannot make your Social Security check go down. So many of you are probably seeing your premiums stay the same. So for 2016, there was no increase in the Social Security cost of living adjustment. So therefore, when we went back, if I can go back here, we went from 104 to 121, your premium stayed at $104.90 a month. It didn't go up. And then for 2017, your check went up by 0.3%. And again, you didn't see that because maybe if your check went up $5, maybe your premium went up $5, but you're still way back here. Maybe you're paying $110 a month, but you should be, if they had kept up or that hold harmless rule wasn't there, should be $134. So what that's going to do, I think, for a lot of people is hopefully we start getting Social Security increases, but as Social Security starts increasing those checks, people aren't going to see that because it's going to get eaten up by the Medicare Part B premiums that are going to be sucked out of that check. So important to know, and I think a lot of people may not totally realize that. The second thing here too is if you are in one of these, oh, hey Matt, got it? Okay. So if you're in one of these upper brackets here where you're paying what they call a IRMAA, which is a income-related monthly adjustment amount, means you're paying more basically than this minimum amount. If you're in that category where you're paying that higher amount, then that hold harmless rule does not apply. You're going to see your increase every year because they basically say that, hey, because you're in an upper income tax bracket, we can raise the rates on you. You're not, you're able to afford it, I guess, basically is what they're saying with that. Okay. The other thing that's happening here too, this is going to be next year for 2018. This is very important, I think, and a lot of people don't realize it. They are shifting the Medicare brackets. And this is going to affect people that are in some upper income levels. So for example, if you're a single tax filer and your income is above $133,501, that's modified adjusted gross income, by the way, which is basically adjusted gross income, and then they add in some other things that have preferential treatment, I think like interest from tax-free bonds and things like that. But if your modified adjusted gross income is over 133,501, or if you're married filing a joint tax return and it's more than $214,000, then you're going to be affected by this. And so let's take a look at what this looks like. And I'm going to try to use my pen here. So let's look at this. So basically, if we look at anybody basically below, we're looking at the married filing joint, below $214,000, there's going to be no change. Where we start to see is what they've done essentially is they've split a couple of these brackets here. So now if your income is over $267,000, in fact I think I might need to change that other slide, over $267,000 as a married couple filing a joint tax return, you're going to see an increase from $267.90 a month up to $348.30 a month. That's a 30% increase. That is very significant. And again, if you're in that bracket, you're making good money, but still a lot of people don't totally realize this. The other thing I want to say about all of the Medicare premiums for Part B is that if you go $1 over that limit, then you're paying that higher premium for the entire year. So usually, if you think about that with our normal tax rate, if you bump up into the next higher tax bracket by $1, you only pay the higher tax on that $1. But here, by bumping up by $1, is going to have, in this case, a 30% increase. And then they split the tax bracket again here from $320,000 and above. You're going to be paying another $100 a month. That's another 22% increase over what it would have been under the rules for 2017. So it's important to look at that, and it's also important to kind of look at what your tax bracket is going to be, and there's a lot of factors that go into that. Not only what your income is maybe from your Social Security and pensions, but your interest and dividend income from the portfolio that you have, and for retirees, a lot of that's going to be how much money you need to take out of those retirement accounts, and looking at how you can potentially minimize that, or deciding which accounts to take money from to supplement that retirement income. And that's something that we do with our financial plan. I'm going to go through a couple things here later on where I'll run through a demo of what our financial planning software will do to help you kind of plan for some of that. So hopefully that makes sense. Okay, so Medicare Part D is the prescription drug coverage. And again, that's something you need to enroll in at the same time you enroll for Medicare when you turn 65. And again, there may be some late penalties if you don't sign up for that as well, just like there is. And here we have another schedule here. So this is again talking about original Medicare. If your income is under that 170 as a married taxpayer, or if you're single making under $85,000 a year, you're not going to pay anything. You're just going to pay the premium for Medicare or for your prescription drug plan. If you're in one of these higher amounts, $170,000 to $214,000, that's going to go up to, you're going to pay another $13 a month, and all the way down here at the higher income levels, that could jump up again to $76 a month. When you start adding all this up, it can really be pretty significant for those of you that may be in these higher tax brackets. All right, now let's talk about what does the prescription drug coverage cover. And I'm going to get the pen out here again. And okay, so first of all, we look down here at the bottom. So we're going to basically work our way up. And the first $400 of your prescriptions, you're going to be paying 100% of that. So all of that's coming out of your pocket. From $401 to $3,700, you're going to have that co-insurance. 25% of whatever drugs you buy are going to be paid by you, and then the plan's going to pay 75% until you've accumulated another $425 in prescription costs. So you've paid at this point $825 in total prescription costs. Now we have this coverage gap, and some of you have maybe heard the term donut hole. That's what they're referring to here, is this coverage gap. So from $37.01 to $49.50, now you're going to be paying 40% of any brand name prescriptions and 51% of any prescriptions until another $500 to $638 has been achieved. And that's going to depend on whether you're getting brand names or prescriptions. So another potential $1,463 of prescription drug coverage there. And then over that, once you get over that $49.60 for 2017, then you're going to be paying essentially a small coinsurance, and that amount's going to be $8.25 for any brand name prescription and $3.30 for any generic prescription. So once you get to that catastrophic level, then those costs are going to be a little bit more contained. 2020, that donut hole is going to be eliminated. And so there's a phase out period here where for 2017, like we talked about, you're paying 40% of brand name drug coverage and 51% of generics. And then that drops a little bit from 40 to 35 in 2018, then it drops to 30% in 2019, and then it levels off in 2020 at 25%. So essentially what they're doing is they're going to eliminate this coverage gap and basically kick you right up to that catastrophic level as soon as you reach that cumulative out-of-pocket there. I think that's good. There we go. Okay. Thought I had a stat on here too. Whoops. So one of the things I want to talk about as we're talking about prescription drugs is that those prescriptions can vary widely from one place to another, one pharmacy to another. There was an example here, and I thought I loaded it into my thing here. But anyway, it was a doctor that had done some research on prescriptions, and he basically sent 6 different prescriptions. It was for all the common things like some diabetic medication, cholesterol. It was maybe some heart medication. There were 6 different prescriptions, and he sent the patient to, or looked it up at Walgreens and what it was, and then looked at it at what it was at Costco or Walmart, and found that those same prescriptions could be gotten quite a bit cheaper by going to shopping it around to different pharmacies. In fact, I think for that example, I wish I had it here, but I think it was like $150 for a year's worth of medications for 6 of what were some of the more common or more popular medications there. So keep that in mind. Don't just assume that it's going to be pretty uniform across the board. If you go to Walgreens or you go to Rite Aid, you could be paying quite a bit more than if you go to more of a discount pharmacy or a Costco or a Walmart. So that could really help keep some of those drug costs down. All right. Okay, so the other thing you want to look at here too is how Medicare works with other insurance. So it's important to understand who the primary insurance is. So you might be still working as an example, and maybe you still have some coverage through work, but your employer still says you got to enroll in Medicare. So they might say, hey, Medicare is going to be the primary insurance company, but we're going to make up and supplement anything over and above that to a certain amount. So understand who that is and where that's going to be, so you know what some of those potential costs are, and look at whether or not your employer is going to make you enroll in Part B, and who's going to pay that. Okay, so a couple things that retirees should know as you start looking at insurance. Number one, find out if your employer is going to provide any coverage for you in retirement. That's very important. And if you are still working and you haven't gone to your HR and looked into that, find out what your employer is going to cover, if they're going to cover anything at all, and understand also how they're going to include anything potentially for your spouse as well if you're married. That's very important. And then you also want to look at what's going to happen to that retiree coverage once you go onto Medicare? Is it going to drop off completely? Is it going to become a secondary provider? Are they going to give you just a flat amount every year to supplement your health care, or are they going to do nothing at all? So understand those things. A lot of that's going to depend on a visit to your HR department to really kind of figure that out. Okay. All right, so there's a couple ways that you can supplement your health care in retirement. One is, again, you might have some insurance through your employer. You could also look at a Medicare supplement plan. So again, we talked about some of the gaps that might be there, especially on some of the co-pays and co-insurances for Medicare Part B, and even for some of the hospitalization and drug coverage as well. So you might want to look at a Medicare supplement plan and look at that. You can also look at a Medicare Advantage plan, which we're going to talk about as well. And that's, again, that's that non-traditional Medicare where they're going to wrap everything in together for you. Okay. All right, so now let's look at one of those supplement plans. Okay, so they call this Medigap. They also call this Plan F, and it, again, helps to fill some of the gaps that traditional Medicare may have. It only covers one person, so if you're married, your spouse will have to have a Medigap policy as well. Does generally not include any drug coverage, so you have to do something separate for that potentially. And it doesn't include any long-term care, vision, dental, eyeglasses, hearing aids, things like that, or private duty nursing. That's not going to be included with the Medigap, but it can, again, fill up some of those holes. Average cost for a Medigap policy, about $1,813 a year for a 65-year-old woman, according to Weiss Ratings. So just to give you an idea, so that's about $150 a month to get a typical Medicare supplement policy that's going to help maybe fill in some of those gaps. Okay, what are those gaps? To go over it again, it's your $1,316 hospitalization deductible if you go into a hospital, even for one day or couple days. It's the co-insurance if you're in the hospital for 61 to 90 days, and it may not cover all of it, but it'll help to supplement some of that. And then also too, it could potentially reduce or eliminate some of the reserve days, which is going to be at $658 a day. So your Medigap policy might cover some of that. It's also going to take care of the Medicare deductible, Medicare Part B deductible of $183. So a lot of them, the Medigap policies might completely eliminate that or cut that down as well. And then it also will help to fill this, which I think this is, for most people, probably the biggest area where you're going to have some cost, and that's 20% co-insurance that you're going to have on your doctor's visits and the tests, the EKG, CAT scan, whatever it is that you may need. That's one of the bigger gaps that I see there on Medicare Part B. And it also could include some of your foreign travel Medicare costs, medical costs, if you travel outside the country. And that's, for some of you that do that, I think that's something very important to know that, God forbid, if you're traveling overseas and something happens, you need to go to see a doctor or an emergency room, not getting socked with a huge bill and having some coverage for that. Okay, now let's talk about the Medicare Advantage plan. They call this Part C. I know there's lots of letters and acronyms for all of these. And again, that's going to combine A and B together, and it's going to basically be managed by the insurance company. There may be some additional benefits. Some of them even include things like gym memberships because they want to keep you healthy and they want to keep their costs down low. And think of it like this, so the insurance company that's going to offer you a Medicare Advantage plan, they're basically getting a check or getting money from the government to basically get you off of Medicare. And that might be whatever, $800 a month or some amount that they think they can benefit from. And now this insurance company is going to try to manage that. And if they're getting $800 a month from Medicare, they want to basically, if they're going to make money, if they provide you with less than $800 a month of benefits, of health benefits. So they're going to try to keep you healthy. So that's why they do things like gym memberships. They might even have other programs in there, fitness programs and things like that they can get you exercising. Some companies will give you like a Fitbit, and if you do so much activity, they might lower your premiums and things like that. So there's all kinds of creative ways. And again, these are private insurance companies. Again, for me, I'm not as big of a fan on this. I would much rather stay on traditional Medicare because I think it gives you a lot more flexibility here. They may, again, try to limit you on what doctors you can see and tell you you've got to stay within a network, and that can be very restrictive for a lot of people. So again, narrower provider networks, and an annual premium for a 65-year-old in a Medicare Advantage plan is about $3,080 per year. So depending on where you fit on that scale, it could potentially be less than what it would be if you went into traditional Medicare. But again, you got to look at those pros and cons and weigh the benefits that you're going to get here versus the cost that you might have with traditional Medicare. And in 2016, 54% of Medicare Advantage plans carried a maximum out-of-pocket spending of between $5,000 and $6,700. So that's, again, pretty steep. Again, it's putting more of that burden on you as the healthcare consumer, and less of it's being provided by the health insurance company. Okay, so choosing retirement health care coverage, just a couple of considerations here. We talked about understanding the advantages and disadvantages between traditional Medicare and the Medicare Advantage. Consider high deductible plans if you're healthy to keep your costs low. I think this is a big one, and for some of you that may even still be working right now, I think it's something definitely to consider as you're still paying into your insurance every year, is that can really be pretty substantial. If you're generally pretty healthy, you could kind of take a little bit of a chance, pay that lower premium, and if you stay healthy, you're going to have more money in your pocket. What I like to do personally is try to combine that higher deductible plan with an HSA. And we did a plan, for example, where my family, we went up to a higher deductible plan, but then we're fully maximizing an HSA every year. And if we end up where we need to tap into that maximum out of pocket, we would have basically taken all the money out of the HSA that we put in for the year and really been at about the same place had we not done it. But if we can stay healthy and not use up that HSA, well, then that money carries over to the next year. And then hopefully if we do that several years in a row, that the HSA will start to build up and accumulate, that maybe even long enough for me to use in my retirement to pay for these healthcare costs that are going to continue to just get higher and higher over time. So you really want to look at that and compare, what is that premium versus what is the maximum out of pocket. And if you're going with that higher deductible, can you offset that higher maximum out of pocket with an HSA? And a lot of times you can, and that makes a lot of sense to do that. Okay. All right, so just a couple things. Obviously, a lot of this is common sense, but how to lower your healthcare costs. Number one is stay healthy. I mean, that's probably the biggest one. Don't use the service, so which is good. Stay out of the doctor, stay out of the hospital, take care of yourself, get a good night's sleep, walk, exercise, keep your stress level down. I meditate every day, things like that can really help, keep you a little bit healthier. That's just going to reap benefits, down the road, and you're going to have a more enjoyable life and a more enjoyable retirement if you're not in the doctor's office all the time. Again, shop for, this is where I put that stat. So shop for prescription drugs at Costco, Walmart, look at online pharmacies. And so that number was, they did, 6 different medications, metformin for diabetes, I can't even pronounce some of these things here, but high blood pressure, high cholesterol, and he bought all 5 medications for $151.82 for the entire year. So again, shopping around can really make a big difference there. Again, look at the Medicare supplement policy. That can help eliminate some of those gaps. And then, and we talked about this earlier too, if you have 2 residences, you can definitely compare the cost of insurance premiums in one residence versus another. All right, so we're kind of moving through this relatively quickly here. Long-term care. So long-term care is not covered by anything we've talked about up to this point. It's not covered by traditional healthcare insurance. It's not covered by Medicare. So long-term care is obviously very expensive, and it's referring to nursing home care. So if you're in a nursing home, or if you need to bring nurses into your home to care for you, to help you with activities of daily living, eating, getting dressed, bathing, all of that stuff is going to be included with that. If you can't function with some of those things, you're going to need to have some help potentially. And a private room in a nursing home last year, I think it was last year for 2000, yeah, I didn't put the year on here, 2016, yep, was $92,378 for 1 year stay in a nursing home. So you can see very quickly how that could really change your entire plans for retirement. And unfortunately, over the years, I've had a few clients that have gone into nursing homes, and I've seen the burden that it puts on the cash flow, and where I think there's the biggest risk in a lot of cases is where you have a married couple and one of the two of you ends up in a nursing home and you're paying all of that expense, in this case a $92,000 cost as an example, and then the other spouse on the outside is trying to still make bills around the house, and if they have a mortgage or property taxes and a car payment, all that stuff, and trying to basically run two households, one paying for the nursing home and the other for the regular household, then it really changes everything quite a bit. A home health aid, a little bit cheaper, $46,000 a year. So I've had some clients, they can get by with that for a while, and then in a couple of cases it gets to a point where you just can't do that anymore, and they need that round-the-clock nursing home care. So you always hear these really scary statistics, and I'm going to show you a couple of them here, but I'm going to maybe talk about why they may not be quite as scary as some people make it out. And the one that you always hear all the time is an average 65-year-old has a 70% chance of needing some kind of long-term care as they get older. And so you think about, oh my gosh, that's, one of the stats I've heard before this was that 50%, now it's up to 70%. But I'm going to talk about why that may not be quite as scary. And again, we talked about this is when you have a spouse or partner that's not in the nursing home and how you're going to need that, how you're going to be able to fund those costs. So we talked about 70% of you may unfortunately need a nursing home, but we want to look at what the average stay is of that nursing home. And so 20% that need to go into a nursing home will only be there for 3 months. And so that actually is pretty low. Another 10%, so 30% will be in there for 6 months or less. And then you add that up, 44%, almost half, will be in for less than a year. And then you start looking down the road here, and only 12% are in the nursing home for 5 years or more, which I think is what I think most people are really afraid of, is they're thinking about, what if I'm in the nursing home and I'm paying that $92,000 a year for 10 years, as an example. And the stats really just don't suggest that the length of stay in a nursing home is really that long. Again, but this is all still probabilities and statistics on what you might be able to expect. And again, even if you're in for 3 years, that still could be close to $300,000 or more in nursing home expenses. So we still need to account for it and plan for it. All right, so let's take a look at a hypothetical example here. And this might be something similar to maybe what some of you have. But let's say $1 million portfolio, you retired very comfortably. And let's say that you're taking a little bit of money out to supplement your retirement. So you're taking $30,000 a year out. You've got some pension, Social Security. You got some living expenses in there as well. I kind of went backwards here on that. But let's look at what that changes if we add in nursing home care. So now we've got your pension, Social Security, all that stuff is the same, the living expenses, but we add in $90,000 for nursing home expenses. Now those retirement withdrawals went up from $30,000 a year up to $120,000 a year. Obviously pretty significant, and what that did was now we went from something that would be probability-wise very comfortable in terms of our withdrawal rate. It's gone from 3% of our portfolio assets to now we're taking out 12% of our portfolio assets. And even if that's only for a couple of years, taking out 12% of your assets to fund these nursing home expenses can be very, very significant and sometimes have a devastating impact that you may not be able to recover from. It would be very difficult to recover from. And so the other thing too is that these extra withdrawals, especially if we have that money in retirement accounts, that could push you up into a higher tax bracket. And like we looked at here back when we were talking about Medicare, it could also force you into higher Medicare Part B and Part D costs. Those can be considerably higher if you start taking out those higher withdrawals, and it pushes you up into a higher tax bracket. So you need to look at that. And then again, if you have two of you, that's where I think the biggest risk is that the surviving spouse or the spouse that's not in the nursing home, how they're going to be able to fund their ongoing expenses. So there's a couple of different ways that you could fund long-term care. In fact, there was a really good article that I read here back a few months ago by Michael Kitces, and he's a great financial blogger. He really writes for financial advisors, so he's a little bit more technical. He's not necessarily consumer-facing, but anybody can read his stuff. And the way he referred to most long-term care insurance policies as a way to prepay for your healthcare expenses. So when you start looking at it and thinking about it from like the insurance company's point of view, you have a 70% chance that you're going to need some nursing home expenses, and you start looking at the cost of it, and you start thinking, okay, well, if 70% are going to need it, in order for me to pay for that as an insurance company, I need to charge a pretty high amount. Versus, let's say, your homeowner's policy, where if you're insuring your home against a fire or a flood or a tornado, the chances of that happening might be very, very low. And your chances of having a fire in your house might be 1 in 5,000 homes or 1 in 2,000 homes. So you can, for a very small amount, pay a premium every year to the insurance company, and if your house is one of the unfortunate ones that has something happen to it, the insurance company is going to pay that for you. But it's keeping your cost low. But when you start talking about something, if there was a 70% chance that your house was going to have a fire or flood this year, well, you can only imagine what they're probably going to charge you from an insurance company standpoint. So there's 3 basic ways that you can fund this. And I'm going to talk about each of them in a couple slides here. But traditional long-term care policies, there's group long-term care policies through maybe your employer that they could offer, and then there's something called asset-based long-term care, which is like an insurance policy or life insurance policy. So traditional long-term care, basically a lot of the companies that offered this have really kind of gotten out of the business. There's only a few companies that really do long-term care anymore. Even some very big insurance names no longer offer this because it's just gotten so expensive and the costs are so unpredictable. But basically here you pay either a monthly or an annual premium that's going to give you some long-term care benefit. The younger you are, the cheaper that's going to be. But again, if you take out a policy when you're 50, you're going to be paying that for the rest of your life, a much longer time period. If you take one out when you're 65, your cost is going to be considerably higher. You're also going to have to get medically underwritten as well. So if you have any issues at all right now, that's going to push those premiums up and maybe even put you in a position where they won't even insure you at all. The insurance company is going to give you a monthly benefit, and it could be something from, for example, from $3,000 to $15,000 a month. So they might say, if you go into a nursing home, we'll pay up to $3,000 of your cost per month, or we'll pay up to $15,000 of your cost per month. Obviously, the higher that number, the higher your premium is going to be because they're going to be paying more of that. But you could kind of decide how much of your long-term care potential expenses do you want to have covered. There's going to be a benefit period. So where some insurance companies got into trouble is they said, we'll pay for it as long as you need it. But again, some of those extreme cases where people were in a nursing home for many, many, many years, that cost the insurance company way too much money. They lost a lot on that. And so now you generally will pick and say, okay, I want coverage for, it could be as little as 1 year, it could be as long as 5 or 10 years, it could be a lifetime. But as you go up, that's going to, again, make those premiums higher. They also could have an inflation protection in there too. So we talked about how much health insurance costs or long-term care costs are going up. You could say, okay, there's going to be an increase every year. And again, if you add that on, that's going to make that premium go up. And then also here too, there might be a waiting period. So you might have 30, 60, or 90 days. So again, we look back at that statistically of how many people go into a nursing home for less than 3 months. I think it was like 20%. So if they don't start your coverage until day 91, well, 20% of the people that have this coverage, they're not even going to have to pay anything for because they're not going to be in the nursing home anymore. And again, your premiums could go up. So once they give you a rate, there's nothing saying that they can't increase that rate in the future. And I've had some clients that have had policies that they've been paying into for years, and then they get a letter saying their premium's going to go up, sometimes very substantially. I had clients that had increases 90 or 100%, so they were paying $200 a month, and it went up to $400 a month almost. And at that point, you really have just a couple of options. You can say, okay, well, I can stop the policy, which means you've wasted all the money that you've put into it up to that point, or you go with a higher increase and keep the coverage. And it's really a tough situation to be in. And then the final thing, and the reason why personally I'm not a big fan of these traditional policies, is that it's a use it or lose it policy. And what that means is that if you don't end up needing it for nursing home care, all the premiums, whatever that was that you paid into over your lifetime, the insurance company just keeps all that, and they use it to pay for somebody that did end up needing it. So keep that in mind. What I do like, and where I think that some people want to have this long-term care coverage, I think one of the better ways to look at it is to look at what we call a hybrid long-term care policy. And what that is it's a life insurance policy that has a long-term care rider on it. And one of the biggest benefits of this is that it's not use it or lose it. So you might buy, let's say, for example, a $100,000 life insurance policy, and it might give you some amount of long-term care coverage. It could be a multiple of that. It could be maybe $150,000 for your long-term care. And how it works basically is this: if you end up not needing long-term care, you have a $100,000 life insurance policy that you bought and you paid into, and your heirs are going to get that completely tax-free, as all life insurance policies are transferred to the beneficiaries tax-free. If you need long-term care, now you have a pool of about $150,000, or it could be more in some cases. It depends on age and a few other factors. But now you might have a pool of $150,000 that you can use for long-term care. And if you end up needing $50,000 of it and then you end up dying, well, then your beneficiaries are going to get the original face value of the life insurance, $100,000, minus the $50,000 they paid for long-term care. So your heirs are still going to get $50,000 tax-free. So again, you're going to be guaranteed, as long as you keep up on the policy, to get exactly what that face value is in either the life insurance benefit or the long-term care benefit. And some policies even allow you to pull back your original investment without any penalty at all. So there's really a lot of options with this, and this is something that we can run illustrations on. I don't do anything with Medicare supplement policies or anything like that, so we don't sell any of that here in our office, but we do long-term care insurance policies, and if you want us to run one based on your age and benefit amount that you want, we can run those for you and give you some examples specifically of how that works. So. Okay, so we're wrapping up here a little bit. So a couple of last minute considerations here. We talked about HSAs. I think for those of you that may still be working and have the opportunity to look at HSAs, I think that's one of the best ways that you can potentially protect against these higher insurance costs. And the HSA is really, for healthcare purposes, one of the best tax-advantaged accounts. So if you think about Roth IRAs as an example. Roth IRAs are funded with money that you have already paid taxes on. You put it into a Roth IRA, and then you get any growth that you earn tax-free as long as you pull it out in retirement. Well, with an HSA, you're actually getting a tax deduction for the amount that goes in. So you put $5,000 in, you get that right off your income taxes when you put the money in. And if that $5,000 grows to $10,000 and then you use it for health care insurance, now you're pulling out that extra $5,000 again. You're not paying taxes on that either. So it's kind of like a double tax-free is the way you could kind of look at that. So HSA is very big. If you haven't looked at that, we're going to talk about getting organized. In fact, actually, I skipped ahead. So yeah. Sorry about that. HSAs, so again, you can look at them for medical expenses, tax-free. Your qualification to do an HSA for 2017, if you're single, you have to have an annual deductible of at least $1,300 a year, and if you have 2 or more people under your insurance policy, you have to have a deductible of at least $2,600. So they're not designed for low deductible plans. You have to have at least those deductibles. And then for 2017, if you're single, you can put $3,400 a year into your HSA, and if you're a family, 2 or more, you can go up to $6,750, and if you're 50 years old or older, there's a catch-up that allows you to do another $1,000. So if you're in your 50s and you have 2 or more people you're insuring, you could actually put $7,750 a year into your HSA. And so depending on your strategy and where you're at for retirement, if you know you're going to have some of these healthcare costs in retirement, and why wouldn't we look at this to maybe put $7,700 a year into that HSA if it's available to us, build that up and take the money out tax-free from the HSA instead of continuing to maybe fund a Roth IRA or a 401k plan at work where that's just going to be a tax issue for us, either when we put the money in or when we take the money out. So again, you could even, if it was an issue, divert some of the savings you were putting towards some of those other retirement vehicles to really take advantage of these HSAs. Hopefully that makes sense. The last thing I want to talk about, or one of the last things, is get organized with your medical stuff. And as we get older, I think we all need to do this. And if we have a medical power of attorney, know where that's at, have maybe digital copies of that. Now we can keep those on our phone or on an iPad. Let people that are important to you know where those things are. If you don't have a medical power of attorney, get one. It's very important to do, very simple to draw up, and basically what that's doing is it's giving somebody else to make decisions for you in a medical situation in case you can't. And that's very, very important to do. You can have multiple layers of that, but your spouse, and if they're not available, you could have other family members or people that you trust. Know where your medical records are. Know who has those. Know where to get them. Have a list of prescription medications someplace that's easily accessible, and make sure your spouse or other important people know where those are at. If you get rushed to a hospital or an emergency room sometime and you can't talk to the doctor, somebody's going to need to know to tell them what medications you're taking so that they can properly treat you, and then know where those doctors' information is. So basically keep a little file. It could be on your phone, or keep it someplace where you know where it's at. And we also offer, as part of our financial planning program, a digital vault where you can actually upload these to our secure financial planning software, and you can access it from any computer or your phone or tablet, and you can pull those down. You can email them to a doctor or somebody that you need to get that to. So keep that accessible, because you're more than likely probably not going to walk around with all these documents everywhere you go, but make sure they're accessible for you, or you got somebody that can do that. So I think that's pretty much it. I'm going to skip over a couple of these last things here. So we did go a little bit over an hour. I knew this was going to be a long presentation. I don't. How many do we have any questions, Matt? Or
Not as of yet.
most people still with us? Good. Okay. So.
Yep.
All right, so maybe what I'm going to do is to kind of wrap up, and I know this has been a little bit longer than our normal broadcast here, a couple of things that I just want to wrap up with. I am going to go through a little bit of a demo of our Wealth Vision plan, and what I want to do in this demo is show you how we kind of plan for some of these medical costs and what some of the capabilities are to illustrate this within a cash flow model. So if you'd like to get some more information about Wealth Vision, if you're not already a client of ours or we haven't already done one, we do offer a free, no obligation consultation. It would be with me. Usually what we end up doing is spending about 10 or 15 minutes on a phone call, talking a little bit about your situation and what types of things you want to get out of the financial planning process, and then we'll talk about how the plan might be able to address some of those things and help you with some of your plans. Matt might even be putting something up on the screen here that's going to have a link that'll take you to some info about Wealth Vision. You're also going to get an email from us too, because you registered for the event, and that's going to have some details about Wealth Vision as well. And if this works, it should be able to go in. Yeah, it does. Good. So this is our Wealth Vision plan, and this is a hypothetical client. If any Cheers fans are out there, this is Norm and Vera from Cheers, and we're going to look at their cash flow. And again, we're going to look at how healthcare costs can be factored into this. And we're not going to get into the whole details of the plan, but basically what this blue lines are illustrating right here is what their portfolio assets are expected to do over their lifetime. So they're in pretty good shape for retirement. But I'm going to click on their total expenses and give you an idea of how we can break this down. So again, one of the most important things I think there is for people to understand when it comes to retirement is really understanding your cash flow and knowing where the money is going, because in retirement, our cash flow situation can really get a lot more complicated than even it was while we were working. When we were working, most of us probably had some income coming in from a job or from a business, and we had some expenses, and at the end of the day, we had some cash flow left over, and we saved that money in maybe retirement accounts. But in retirement, in fact, I'm going to back up a slide. In retirement, we actually have sometimes multiple sources of income. So when we look at income here for Norm and Vera, we can see that they have Norm's income, and that's going to stop when he turns 62. Right now he's 56. Then he's going to get a pension for the rest of his life. Vera's got some income coming in. And then we have Social Security for both of them. And some of you may even have other sources of income like rental property income or income from a business. And so all of this can map out. We can start and stop different sources of income. Maybe you have a buyout that you're going to get for 10 years, but then that's going to stop. So we need to account for what does that cash flow situation look 10 years from now. And then the expenses are also going to be interesting to look at too. So of course we've got some living expenses, but when we look at this, we also see liability payments. Well, their house is going to be paid off before they retire, so their cash flow is going to change at that time. Some of you may still have a house payment into retirement, but maybe it's going to be paid off in year 4 of your retirement. So understanding, what that change in cash flow is going to do and how that might change the amount that you need to take from retirement accounts or how it might influence your decision to take Social Security. We want to look at that all within the context of our cash flow. And then when we look at these other expense flows, what I did here is I illustrated in some of these healthcare expenses, and you can see a lot of different things. We start back up here at the light blue line. That's their first year of retirement, and we have, I don't think I can draw on this page, but can I draw on this page? No, I guess I can. So Norm's pre-Medicare insurance at $10,589. Vera, she's the same age. She's going to have the same healthcare expense. And so again, that's that Affordable Care Act policy that they're going to need to get until Medicare. And so they're going to have to account for higher medical expenses maybe for those first 3 years. And then what we see is once they turn 65, now we have a Medicare premium, and now we have also a Medicare supplement policy. So if any of these things change, we can very easily see what impact that has on the cash flow and the total expenses. And then we can go back here, and then we can start looking for them as an example of, I can blow that up. Okay, so yeah, that's good. So I can look at what their cash flow is, and we can see, okay, they're in good situation. They have a few $1,000,000 here, $3 million, $3.5 million in retirement. But you can also see here too these negative cash flows, and that's not a big deal. That's why they save the money. But now we know what we need to account for. That we need to account for about $120,000 a year of withdrawals from the account. But again, medical, because we're talking about that, I wanted to show you how we look at that. But we can also look at things like maybe you want to downsize your home, move to something smaller. Maybe you want to buy an extra home. You want to buy a vacation property or a home someplace warm, or you're going to rent something. We can look at all of those different factors there and see what is that doing to the cash flow. And then also, if we come up here to income tax, and this is a big part of what we do as well, we can also look at what your tax rate is likely to do over time. So you can see they're in a pretty high tax bracket, an effective tax rate of about 25% while they're working. They end up with a couple of years here early on where they're in a low tax bracket, 3% for 2 years, and then it jumps up a little bit to 13%. So knowing that can really help you do some very critical planning. You can say, okay, during those low tax years, maybe a Roth conversion strategy is something that makes sense, and we can shift some money, take advantage of that low income tax rate, and move that money over to a Roth. All kinds of different things. And then really when we look at this too on the federal income tax, now we really can look at things like their adjusted gross income. So now we can start to see, okay, are there any of these years, based on what we know about Medicare premiums, are they potentially going to hit some higher amounts? And sometimes it may not be quite that apparent that they're going to hit those amounts because we don't know, based on the plan before we do it, what they're going to need to take out of their retirement accounts. And that is going to have potentially a really big impact on that tax return and on their cash flow. So when we go back here And this is the last thing, and then we'll wrap up here. So you can see here, planned distributions. So many of you probably know that if you don't have a plan for retirement plan withdrawals, don't worry, the government has one for you. It's called the Required Minimum Distribution Rules, and so this will show you a pretty good estimate of how much the government is going to force you to take out of those retirement accounts. And so, you know, for some of you that have built up substantial assets in IRAs and 401k plans, you could end up in a situation like Norman Vera where you're being forced into taking out $150,000 a year, or in some cases $200,000 a year from your retirement accounts and paying taxes on that. So you may not think you're in a high tax bracket today, but and you don't think that you're going to be affected by some of those Medicare higher premiums, the income related monthly adjustment numbers that we talked about. It very well could be that these required distributions are going to force you into that. So anyway, I hope that makes sense. Again, if you want to talk more about Wealth Vision or have that free introductory call, then just let me know, shoot me an email, go to the page, and I think there might even be a button on the page where you can schedule that intro call right from the page. And that is it for the presentation. I don't know if we have any questions. It went long, but I felt like I talked really fast. Probably glad that I did, because it would have been even longer if I talked slow. But this was definitely one of the longer presentations that we have done and probably will do, but there was just so much with Medicare that I wanted to make sure that I got it all in, and I hope it was helpful for everybody. And if we don't have any questions, I think we'll sign off.
Must have gotten all the information in.
Okay, or I got everybody glazed over. I don't know, but no. Thank you all for joining me. These monthly live streams, I know we kind of took the summer off. We didn't do them because we were traveling, clients were traveling. We decided to kind of regroup and get back to them in the fall. We sort of missed September because we were doing things with our regular business, but we are going to go back to doing these monthly. I think next month for November, we're going to do one on 401k investing, and that's going to be, we've done that one before. It's always one of our most popular ones. We'll probably do maybe a Social Security one for December. So we've got about 4 or 5 of these, and we try to do one, like I said, every month. And if you haven't already, check out our social media, like us on Facebook, subscribe to our YouTube channel, whatever means that you like to follow things on social media, follow us, and you can stay up on all the things that we're doing. And have a great evening, everyone. I'll see everyone hopefully back on one of our future broadcasts, and I'll get to talk to everyone soon. Thanks. Have a good night.